afternoon, everyone. I'm Jim Wascom. I'm the director of the Governor's Office of Homeland Security and Emergency Preparedness, and I want to thank you for coming out and covering this for us. Obviously, it's an important day for us here in Louisiana, and especially in Baton Rouge, as we work to stop the spread and to work to eliminate COVID-19. Through the efforts of state, local, and federal agencies, we're announcing the opening of a mass vaccination site here in Baton Rouge, which is set up just behind this building. I want to take a moment to thank all of our partners at each level for their tremendous work to get this site ready in a matter of days. This actually, the planning for this actually occurred pretty quickly over the last week or so. And today, I just want to publicly thank Mayor Broome and her team have been phenomenal in first volunteering to host the site and in doing all the work to set it up. But also, I want to thank Tony Robinson, the FEMA Region 6 Administrator, who's here with us today and who'll be saying a few words to you after Mayor Broome. But it's been a tremendous effort. Of course, we have the Marines here in force as well with Major Greiner and his team from active duty Marines. And then I want to publicly thank Clay Reeves, my counterpart here in East Baton Rouge Parish, and Mike Kimball with the fire department, who's the incident commander. So also I'd be remiss if I didn't mention General Keith Waddell, the adjutant general, and his team, specifically General Cindy Haygood, who's actually the dual status commander here on site, and Major General Estrada, who is here as well. From U.S. Army North out of San Antonio. So, look, the disaster management cycle goes something like this. It goes prevent where you can, prepare, respond, recover, and then mitigate, and that cycle never really stops. So the piece about prevention is where we're at. We want to stop. We want to prepare for and stop the spread of COVID-19, and that's why we're doing this. The ongoing severe weather has added additional challenges, as you all know, but we're still on track to open tomorrow as scheduled. I want to point a few things out on the weather event. Governor Edwards has issued or will shortly sign a state of emergency due to the ongoing threat from the weather that's been going on this week. The potential for heavy rains, damaging wind, and hail remains in some areas throughout about Saturday at noon. So we'd ask everybody to please stay weather aware and avoid driving on flooded roadways. Also, I want to just mention briefly, our prayers are also with the crew and the families of the lift boat that overturned in the Gulf of Mexico during an earlier round of severe weather, and let's keep them all in our thoughts and prayers. We will continue, GOSEP will continue to support that rescue mission down there. Any storm-related requests from parish emergency directors, and of course any additional support needed for this mass vaccination site. Please, I want to say this to the citizens of East Baton Rouge and surrounding areas. Please utilize this wonderful resource while it's being offered here in Baton Rouge. I think there are 28 states in the nation that FEMA reached out to. So it's not every place in the United States that gets this resource. So please take advantage of it and come out and utilize it. If you know anyone that needs to be vaccinated, help us get the word out and get them registered. I'll now hand things over to Baton Rouge Mayor President Sharon Wester Broome. And again, Mayor, thank you for stepping up to take on this site for us.
Thank you, General Wascom, for the information on our Community Vaccination Center and for the update from the Governor's Office of Homeland Security and Emergency Preparedness. Before I begin, I ask all of you to keep Governor John Bel Edwards, First Lady Donna Edwards, and the entire Edwards family in your prayers. Governor John Bel Edwards planned to be here today, but unfortunately his father-in-law passed away and he is with his family today. But we have representatives here from the local, state, and federal government because this truly has been a partnership between so many agencies. This collaboration between our local, state, and federal government entities will empower us to vaccinate thousands of East Baton Rouge Parish residents over the next 8 weeks. It's time for East Baton Rouge Parish to join the statewide effort to bring back Louisiana, and it's time for all of us to roll up our sleeves and go get vaccinated. Over the next 8 weeks, we have the power to make transformative change in our community. This is our shot, no pun intended, to bring back Baton Rouge. We can bring back our community and ease our way into this new sense of normalcy that we have worked towards for over a year now. We can bring back our traditions, our celebrations, our festivals and events. We can bring back family gatherings, birthday parties, holidays, and Sunday dinners without the fear of our loved ones falling ill. We can bring back the Louisiana we know and love, but we need your help. If we want to return to the traditions that we know and love, we need our residents, our leaders, our essential workers, and everyone in between to step up to the plate and join our campaign to go get vaccinated. This collaboration is working to make vaccines available, accessible, equitable, and available to each and every resident in our community. In order to best reach every corner of our parish, we're operating a hub and spoke model with our vaccination sites, with Bon Carré serving as our central vaccination site. The decision to host the site on Florida Boulevard is no coincidence. It was chosen for it is a centralized location within our parish. The Bon Carré Business Center lies directly within the center of our community, making it easier for residents to access regardless of their location. This central site will be operational for 6 days a week over the next 8 weeks. Our team is ready to welcome our residents to receive their vaccine. But we know one large location is not enough to reach every citizen of the parish. So we've worked with our partners to set up remote spoke locations in neighborhoods and areas of highest need. This will bring the resources to the doorstep of the community, eliminating barriers to vaccination. These locations are already underway, and we will have vaccination sites at Leo S. Butler Center on April 16th and 17th, Jewel J. Newman Community Center on April 23rd and 24th, Martin Luther King Jr. Community Center on April 30th and May 1st, Charles R. Kelly Community Center on May 14th and 15th. And more sites are underway. We're looking to work with community partners to establish more spoke locations across our parish. If your organization is interested in hosting a vaccination site, please reach out to covidoutreach@brla.gov. That's covidoutreach@brla.gov. We know there are many questions, concerns, and uncertainty in the community surrounding vaccines. That is why my office, in collaboration with all of our partners here, are sending community members into neighborhoods with low vaccination rates to speak with residents about these safe and effective vaccines, as well as the importance of getting vaccinated. I want to take a moment to recognize the teams from Together Baton Rouge and the Power Coalition who are joining us today, and they're proud partners of the Louisiana Department of Health's Bring Back Louisiana campaign. This effort has graciously joined our Go Get Vaccinated effort. This team will be canvassing our neighborhoods in bright blue and orange Go Get Vaccinated t-shirts, working to spread this information to our residents. They will be carrying out vital outreach for our vaccination sites. This team is here, as I said, with us today. We want to thank each and every one of you all for your efforts. We know that our residents face barriers to vaccination, especially when it comes to broadband access and technology use. In addition to spreading information and awareness, our canvassing team will help register residents for their vaccination appointments. Our hope is that this will help us eliminate yet another barrier to vaccination that is currently facing our residents. We're working to spread this resource to our community because we need everyone on Team Vaccine. These vaccines are safe, easy, free, and most importantly, effective. East Baton Rouge Parish has waited for this moment since March 13th of 2020, when we initially began our response to this pandemic. The time is now, and the moment is here. We can all go get vaccinated and bring Louisiana back. You can register for a vaccine at brla.gov/get vaccinated. That's brla.gov/get vaccinated. Register at our site or call the COVID-19 vaccine hotline at 1-855-453-0774. That's 1-855-453-0774. We will help you join Team Vaccine because we're counting on you to help us make this effort a success. I now have the pleasure of introducing you to Dr. Joseph Cantor, the State Health Officer with the Louisiana Department of Health. Dr. Cantor will be followed by Tony Robinson, the Regional Administrator for FEMA Region 6, and also joining us today is the Regional Director for the Louisiana Department of Health, Dr. Don Marcel. Dr. Cantor.
Thank you so much, Mayor. Good afternoon. Thank you, General Wascom, as well. I'd like to add my voice to the thoughts for the families of the one individual who is confirmed dead and 12 remaining at large as of this morning from the lift boat accident in the Gulf of Mexico. We'll continue to have our thoughts out for those families. On behalf of the Louisiana Department of Health and Secretary Phillips, it is my pleasure to profusely thank Mayor Broom, your team with the City of Baton Rouge, East Baton Rouge, Administrator Robinson, your team with FEMA, and all the community partners that are here to help launch this vaccine site. A lot of work has gone into this, a lot of preparedness have gone into this, and a lot of people have put their heart and souls into this event with the singular goal of bringing back Louisiana, and as the mayor said, bringing back Baton Rouge. This is our shot, as the mayor said, and COVID has been a long haul. It's been a long haul for everyone, and we are truly blessed to have the vaccines that we have right now. And this is our opportunity not only to protect yourself, protect your loved ones, but bring back the life that we have had to put aside for the past year. We are going to have a lot of supply made available through FEMA and the federal government at this site, and it's going to take a lot of hard work on all of our shoulders to get people vaccinated, but that's what we're going to do because this is a unique opportunity that will be here in East Baton Rouge. I also want to thank and acknowledge the 136 Marines and Navy active duty and the 60 National Guard members here that are helping with the efforts, as well as some folks from the Louisiana Department of Health team that have been working very hard behind the scenes, and that's Allie Neal and the communications team and Kim Hood and the Office of Public Health team who have been doing a lot of work to get efforts underway here. This operation could not have come at a better time for Louisiana and for East Baton Rouge. And let me explain why I say that. On one hand, we have made tremendous progress in the vaccine effort, and I'm very proud to say that as of today, we have completed the vaccine series in over 1 million Louisianans, and that's a tremendous accomplishment. On the other hand, we have some potential risk ahead. And I'll tell you that while we have made great progress coming down from a high peak in cases and hospitalizations around the Christmas and New Year's time, that progress has stalled in Louisiana as it has in many places across the country. This past week, we've had increases in percent positivity in 6 out of the 9 regions of the state, including in the state as a whole. Hospitalizations have creeped up just a little bit from around 300 to around 330. And we're hearing some reports from emergency departments across the state that they're getting busier. They're seeing more patients with COVID-like illness. And in what's following accounts we hear from other states, they're seeing younger patients with COVID-like illness. We are following closely what's happening in Michigan and happening in the Northeast, where spikes right now threaten to undo a lot of the progress that was made. And we're keeping a very close watch on the variants, particularly the B.1.1.7 or the UK variant, which I can tell you right now we've identified 247 cases in Louisiana, but as we've talked about for many weeks now, we know there are many, many more. The CDC tags the percent of all COVID in Louisiana that is likely to be the B.1.1.7 variant at 34.4%. For a little bit of comparison, the U.S. number right now is 44%. Florida is at 52%. Texas is at 42%. We increased from 27% last week. So the variant continues to spread. We know it's more transmissible. And we know from looking at states like Michigan, it can cause a spike. And we are also cognizant that Michigan has a little bit more percent vaccine coverage than we do right now. So although we've made good progress, we're not protected from this. There are exactly two things we can do to protect ourselves against what would be a fourth spike of cases in Louisiana. One of those is to institute more mitigation measures, more restrictions. The other of which is to increase vaccinations. I think everyone in this room would much rather do the latter. So let's get vaccinated. Today, I can tell you that 30.3% of the state's population has initiated the vaccine series, 21.3% have completed the vaccine series, and 73% of our Louisianans aged 65 and above have initiated the vaccine series. Those are encouraging numbers, but we still have a decent ways to go. As the mayor mentioned, we have a hotline functioning right now. It's open till 8 p.m., 7 nights a week. That number, one more time, is 855-453-0774. I can tell you in just under a week of it being operated, we fielded over 1,000 calls of people looking for vaccine appointments. You don't have to call this number to make a vaccine appointment, but if you want information about where vaccine is available close to you, and if you want help making an appointment, particularly if you don't have good internet access, this hotline can do that for you, and I encourage you to call it, find out where vaccine is available close to you. I do want to comment a second on the Johnson & Johnson news, which came out earlier this week. What the federal government announced, what the CDC and the FDA said, is they recommended states pausing use of the Johnson & Johnson vaccine because they identified 6 individuals across the country that had a very rare but severe type of blood clot associated with low platelets, which is an abnormal presentation for these type of blood clots. 6 people out of about 7 million doses of Johnson & Johnson vaccine that have been administered. The federal government did not require Louisiana to pause vaccinations, but we did on their recommendation because it's the right thing to do. And this is why it's the right thing to do. Number one, it gives CDC and the FDA a little bit of time to investigate more what's going on, and more importantly, for us to communicate with clinicians, docs and nurses, about what to look out for and how to treat this if it does arise. We've not had any reported cases in Louisiana. The other reason why this was the right call, a difficult call, but the right call, is because if anyone has any questions about how serious we take safety with these vaccines, this is the evidence right here. 6 cases out of 7 million is what prompted this. We have pledged to you from day one that we will roll out these vaccines with safety and transparency, and this is the evidence of that right now. Nobody takes safety more seriously than the Louisiana Department of Health on this, and I will assure you that we will continue to be immediately transparent. We hope to get Johnson & Johnson back online soon. We hope to get more information about this, but we will not put the cart before the horse, and safety will always be the most important factor. The vaccine that will be given out at this FEMA site right here for the next 6 weeks will be Pfizer. And I can tell you Pfizer and Moderna continue to be available in good quantity. They continue to be exceedingly safe, and they are unaffected by this news about the Johnson & Johnson. We've done incredible work so far throughout COVID. And I'll remind people that for a couple weeks in the middle of March 2020, Louisiana led the world to date at that point in time in how fast cases were growing. We had an increase in cases back a year ago that was faster than Italy, faster than South Korea, faster either than the Wuhan region of China at that point in time. We've overcome quite a lot, and this is essentially the last 2 minutes of the game, is completing the vaccine rollout. And that starts right here with this FEMA site. So if you've already been vaccinated, I thank you for that. But I have a request of you. I would like to call on you to think of yourself as an ambassador. Share your experience. Share your thoughts on the vaccine. Share what it meant to you and what it was like with your friends, your family, and your coworkers. And try and encourage those around you to get vaccinated as well. It's how you protect yourself. It's how you protect your family, those around you. And it's how you bring back Louisiana, and we will do that. Thank you very much. I'd like to ask Administrator Tony Robinson to come up.
Thank you, Dr. Cantor. Let me just start as well by sending out the thoughts and prayers of the men and women at FEMA to the lift boat crew and their families, and to Governor Edwards and his family as well. Also, I want to assure the citizens of Louisiana that in addition to the vaccine effort that FEMA is here to help with, that we are still working with our state and local partners to support the recovery efforts from last year's hurricane season and from the winter storms from this year. This vaccine center is really an important effort for us. If you heard from Mayor Bloom, Dr. Cantor, it's all about getting shots in the arm to citizens of Louisiana. And certainly the focus here is to work with the most vulnerable populations and those that are most at risk. And so we've talked a lot about partners and partnerships, and I've got to thank Mayor Broom, Clay Reeves, Chief Kimball, just the work that Mike Kimball, the work that they've done here on this site to get ready in a short period of time. Also GOSIP, Director Wascom, his staff, Dr. Cantor, Louisiana Department of Health, takes us all working together. But the most important partner in this operation will be you, the citizen. We need you to register. We need you to come get vaccinated. And Dr. Cantor made a great point. If you've been vaccinated, share your experience. Get somebody, bring a friend to this site so that we can vaccinate as many people as possible. We're going to provide, what FEMA is doing is providing extra vaccine to the state of Louisiana so that we can go above and beyond. We're not going to impact other sites so we can keep other sites operating, but we can also have this site here, once again, to provide additional vaccine. So what's important to us, you heard the mayor talk about brla.gov, get vaccinated. Go there, register, or call 1-855-453-0774. You will be what makes this a success, so thank you very much.
Thank you, Dr. Cantor and Mr. Robinson, for joining us today, and thank you for your continued partnership throughout this process. So you've heard from all of us. This resource that we have here is invaluable to our community, and we must act upon what is available to us. You've heard from Dr. Cantor countless times. These vaccines are safe and effective. They have been tried and tested. They've been proven to reduce COVID-19 hospitalization and save lives. You've heard it from me, you've heard it from Governor Edwards, you've heard it from General Wascom, you've heard it from Dr. Marcel, Mr. Robinson, and countless others. It is up to all of us to rise to the occasion. Go get vaccinated and bring back the Louisiana we know and love. We've endured this pandemic as a team, and we must do the same to emerge on the other side. Our community vaccination center stands up tomorrow, April 16th at 8 a.m. You can register to join us at brla.gov/get vaccinated. You can register on site, or you can call the COVID-19 vaccination hotline at 453-0774. Make an appointment for yourself and not only encourage your friends and loved ones to do the same, but offer assistance to get them signed up as well. If you've already been vaccinated, you can join us by acting as an ambassador for Go Get Vaccinated. Help your mom, dad, grandparents, siblings, spouses, children over 16, friends, co-workers, and neighbors register. Equip them with information and bring them on to Team Vaccine. I'm sure many of us recognize the incentive of protecting our health and those around us, but I want to let you know that our partners are hard at work to offer additional incentives to those who visit our vaccination sites. Tomorrow, we will have free jambalaya from 11 a.m. to 6 p.m. I see smiles on faces already. The team from 94.1 will be joining us from 9:30 to 11:30 a.m. to encourage vaccination, and we will have a limited supply of Amazon gift cards available on a first-come, first-served basis. Additionally, the Sci-Fi chapter of Chi Eta Phi sorority has donated $5 Walmart gift cards that will be available for the first 50 vaccinations each day. It's our hope that you will recognize all of these incentives surrounding vaccination and make the decision to roll up your sleeves and go get vaccinated. Together, we can end this pandemic and bring back the life we know and love. It will take all of us, though, working hand in hand, even while 6 feet apart, to restore our community. Lastly, before I close today, I would like to once again thank everyone who has played a role in making this site a reality. Our team at the Mayor's Office of Homeland Security and Emergency Preparedness, our Department of Public Works, Department of Information Services, Emergency Medical Services, City Parish Radio Shop, Baton Rouge Fire Department, Police Department, Louisiana National Guard, Marine Force, Louisiana Department of Health, Louisiana Office of Public Health, the Governor's Office of Homeland Security and Emergency Preparedness, and FEMA, the Federal Emergency Management Agency. What a team. Our community is forever grateful for the work you have put in over the last year. And I know this partnership will positively impact the entire Baton Rouge area, the capital region, and the great state of Louisiana. God bless, sleeves up, go get vaccinated. Now we'll take any questions that you might have. Yes.
What's the capacity for how many doses can be administered every day or over this 8-week period? How much is supplied?
Well, we have a supply of at least 3,000 a day, so we can take as many people as possible. We encourage everyone to come out. Yes.
Will you be saying if it's Pfizer, Moderna before, like at the beginning of each day, or will it only be a certain?
Well, we're saying right now it's Pfizer at the moment. It's going to be Pfizer throughout the time, to my understanding.
Gotcha.
Any other questions? Well, great. Please spread the word, and thank you all so much for coming out today.